Welcome to Focus on Seniors, a television show sponsored by Helping Seniors of Brevard County, Florida. The show is designed to make you aware of senior issues, needs, and resources available to help us age in place and with dignity. This show will help you as you develop your own aging and care plan.
I'm Joe Steckler. Welcome to Focus on Seniors, the television arm of Helping Seniors of Brevard County, a show designed to provide you with information on how to develop your own aging and care plans. Today, our topic is over-medicating. And with me in the studio is Dr. Lee Sheldon of Solid Bite Dental Implants. Welcome, Lee.
Hi, Joe.
Glad to have you here this morning.
It's always good to be with you.
Yeah, I never have to worry about your shows being unanimated, if that's a word.
Well, that's the way it should be.
Yeah, I was...
Particularly when we're talking about this grave topic called over-medication.
I know, and you know, it's an amazing thing. I said, I want to go over some of the stuff we'll talk about, and I've got a copy of your book sitting on the desk here, and folks, I'll pick it up. We'll show it to you again. It's the Ultimate Mouth Manual. It's a book that Dr. Sheldon has written. It makes dentistry very simple. But Lee, in the book, you talk about other things like osteoporosis. Yep. You talk about over-medicating. You talk about migraine headaches. Yep. You talk about headaches. And we're going to do another show on headaches, but this show here is on over-medication. But it's amazing to me how the mouth and the passage of the mouth through near into the body, and how else it affects the sensory muscles that go to the brain, and all the impact that the mouth has on the whole body.
Oh, it does. It does.
But it's a whole another side of medicine that's not really discussed.
It is, and we're going to discuss that in future shows. We are going to talk about how the mouth can be involved in headaches. But today we're going to talk about how the mouth is ingesting things that it may not want or may not need. And that's the crux of the situation today. Because while I'm a dentist, as I've proceeded with my dental career, I've seen the medication list go from this all the way up to this.
I know.
And I'm just wondering if we really need to take all those medications. Now, I'm only a dentist. I'm not a physician. But at the same time, there are certain observations that we all have as a person and maybe as a slightly trained individual, maybe more than slightly. And that's what I want to talk about today.
But in my case, you did 4 implants on me.
Yeah.
You did 3 implants and put in a bridge for 4 teeth.
Right.
But in a process of treating me, you used medicines. You used amoxicillin.
Yep.
And you gave me Demerol if the pain was going to be excessive.
Yep.
And I have to tell you, of the pills you gave me, I only used 2, and it really didn't make any difference because I didn't have that much pain. And but like any good doctor, good dentist, you recognize that there are times for medications, and that's why they're there. They're not there just to see if how many you can put into somebody's body.
That's right.
And but the other thing is that I learned, and I wasn't aware of this, that doctors have a capability on the internet where they can put the medicine that they're giving you in there and see how it interacts with other medications you might be taking.
That's correct.
And that's the reason a good doctor, your primary care physician, does and should review your medications with you periodically.
Correct, and the pharmacist also has that ability.
So that's something else we forget about, is the pharmacist.
So it comes up and the pharmacist sees the medication you're taking, and if there's some adverse interactions, then the pharmacist will call the physician back and say, by the way, did you know whatever that situation is, and then the doctor can make the decision as to whether to maintain that medication or to use a different medication. The pharmacist, and pharmacists are very important here. I know we're talking about over-medication. Let's talk about medication protection here as well. The pharmacist will be doing a medication history, including allergies. And so, for example, if by mistake, and mistakes happen, a physician would prescribe something you might be allergic to, the pharmacist looks that up, and it automatically comes up saying, hey, this person is allergic to this one, let's get something else. So there really is a very good fail-safe system in that arena of medicine.
You know, I'm retired military, so we have a capability to get medicines on the open market, not, say, through the military system, if the military system doesn't carry a certain drug. So I had normally gone to Walgreens before, but Walgreens stopped taking the medications on issuing medications to the military.
Yeah.
But CVS Pharmacy does it. So my primary care doctor put me on a different medicine that the military formulary did not carry, so I had to go buy it on the open market. A day after I turned the prescription in to CVS, they called me to ask me some questions. So to me, and that's the first time I've ever had a pharmacist do that.
Really?
Yeah.
Okay.
But it's something we don't realize how much, a lot of people do not realize how much training a pharmacist has.
Right. Pharmacy training was 5 years. I believe it's 6 years now in order to become a pharmacist. So it isn't just counting out pills and dispensing pills. That isn't what they do. Anybody could do that.
Yeah.
It's really knowing, because these are chemicals. These are chemicals that you're placing in your body in order to produce a chemical change in the body, which we hope and anticipate is desirable. And of course, we're going to talk about the other end of it. But if that's occurring, then you need quite a bit of training and background in order to be able to do that. And that's why you can't just depend upon somebody just to count out pills and put it in a bottle.
Yep. But the reason I commented on the fact that you do use, while you don't like people just taking medicines. I know that. But you recognize that there are needs for medicines, but you also believe in, I don't know, I forget the doggone word for it, but like things like Juice Plus, which is it's a supplement.
That's fruits and vegetables in a capsule. That's what that is. Yeah.
But it's not anything that's going to hurt you.
Right.
Yeah. So, but let's get back to over-medicating.
Okay.
And why are you really so concerned about this? And what are some of your concerns and fears and thoughts on over-medicating?
Well, let's talk about the reason to go on medications to begin with. The first is what you described. That's acute medication. Medication for an acute problem. So, for example, you had surgery done, and therefore there are certain things that we needed to do to get you past that acute phase. Let's assume that you have a major infection. You need antibiotics to take care of that infection. That's to get you past that acute infection. That's one part of medicine, and it's an important part of medicine. There's another part of medicine which is sometimes called preventive medicine, but it's those medicines that you take on a daily basis, or sometimes twice and 3 times a daily basis, for the rest of your life. And that's the area that can be that we're addressing today. Because if you're taking a medication for cholesterol, and if you're taking a medication for high blood pressure, and you're taking a medication for osteoporosis, even though we know some of the interactions between one and the other, we have no measure of interaction between medication 1 and all of the 5 or 6 or 7 other medications that a person is taking. So, in fact, a person can be taking what is described as polypharmacy, more than 6 medications. And if that's the case, I believe it's maybe more than 4 medications. And we have no idea how those medications interact with each other.
But doesn't when your doctor puts the pill into the, isn't the reason that the doctor wants to know if you're taking separate medications so that if the medication he gives you, how does this magic system on the internet tell you that medicine is good or bad if it never tests reactions?
It only tests one reaction of one with another, but we have no idea how 5 and 6 pills mix together. and what they do to each other. We really are going in that with a very scant amount of knowledge. But that's not even the area that I'm concerned with. There is something called diagnosis. Let's assume a person has an illness. A diagnosis is made. Let's assume the person has bronchitis. A lot of people have bronchitis, and so let's assume that diagnosis is made. The diagnosis is bronchitis. The next step is, let's take a pill. Okay? If a person has acute bronchitis, meaning there's an infection there, yes, let's take a pill. Let's take the antibiotic and let's take the steroid to make it better and make you feel better. But there's a reason that you were susceptible to the chronic bronchitis to begin with. And the unfortunate part about medication is once you're on a medication, you continue on a medication in order to control a symptom when in fact there's an underlying cause which, if addressed, could eliminate the need for the medication. So we become dependent on getting medications on a monthly basis and taking them on a daily basis in order to control the symptom. And what I'm saying is there are other things that can be done and other things that should be looked for so that while you're on the medication to try to control those symptoms, that's not the end of it. Let's find out what the cause of that is so that you don't have to take those medications later on. But the other thing is this. Don't mean to interrupt you, but there are a couple parts of this. The second part of it is taking a medication, and that medication produces side effects, and so you take another medication to control those side effects. And that can go on and on and on. So, for example, you take a medication to control one thing, but you have indigestion. So you take another medication to control that indigestion, and that produces something else. So it's a never-ending chain. Besides having one or two or three or four physicians that are all prescribing medications, and there's very little communication among those physicians, and even if there isn't one physician who's going to recommend that the other physician take you off medications, it becomes a problem. And what I want patients to focus in on, and frankly, what doctors who are overburdened, you know how many patients a doctor has to see now, particularly with lower reimbursements. They can't take the time. It's easier to write the prescription for the medication.
I agree.
But it is up to you. You, the patient, I'm not talking just about you, but you too, is to look and say, all right, I've got a disease. I've got a problem. I understand my doctor is trying to get that problem under control by giving me a drug. And it's a drug. It sounds better if we say medication. It's a drug. And so if you're taking a drug, let's make up our minds that in fact you have a problem. And that problem was caused by something. So read a book. Find out about that something. It's amazing what you'll find out. And the books aren't written for guys like me. They're written for guys like you.
I know. That's why I read the Ultimate
There you go. Yes.
But seriously, Dr. Sheldon has explained in this book some very serious things in a very simplistic way.
I'd say simple, not simplistic.
Well, okay, simple. Yeah, I'm not calling you simple. That's the last thing I want to do. But for instance, a lot of us don't understand how the tooth goes down into the jaw and what a root system really is, and when a tooth fractures, what it really does. But you've got some pictures in this book. I think you probably drew them yourself.
I did draw them myself, yes.
But they're easy to understand.
Thank you.
That's the whole purpose of it. And let's go back to the over-medication business here again. I sit down periodically with my primary care doctor, and we look at every medication I take. And when I go to my cardiologist, he makes sure that he knows all the medications I take. But I realize the value. And one of the reasons I realized the value of a doctor knowing this, when I had command of the Navy retirement home in Gulfport, Mississippi many years ago, I had one of our residents that was from over near Baton Rouge, or Slidell. And he would come in and visit me all the time, and he ended up in the hospital a lot. And he came in to see me one day, and I said, how many medications do you take? 20.
Yeah.
20 medications.
Yeah.
I said, and he was seeing 3 doctors. I said, do those doctors know what they're prescribing for you based on what the others are getting? He said, nah, he says, I never have told them. I said, you can't do that. You have to talk to them. So several weeks went by, and I noticed the guy was looking pretty chipper. What I think he did, we went to his own wellness clinic that I want to talk about in just a minute.
Okay.
But what he did was just stop taking the 20 pills on his own.
Yeah.
Now that's a drastic thing.
It is, and don't ever do that.
Yeah, we both
make sure there's medical supervision going on if you ever decide. Yes, the goal should be to get off every medication you possibly can, but yes, you have to find a physician who's going to monitor you very carefully during that time, and certainly not go off all the medications at once.
But that's something else. You know, you've told me a couple of times you went to what you call a wellness clinic.
Yes.
It's
a great place.
Yeah, but what happened? You never really did tell me what happens at a wellness clinic. Why? How is that involved with drugs? Because I know that you've told me that you've seen people at a wellness clinic that were taking all kind of medications for a heart, and at the wellness clinic they were able to get off all heart medications.
Yeah, well, diabetes medications is what I saw. I don't know about all the heart medication, but there have been people who, there have been patients, I'm sure, that got off all their medications. That's frankly the purpose of the clinic, is to make sure that that all of the things that are causing problems, let's assume you have a circulation problem. Okay? So let's assume the blood just isn't going through the body correctly. And so you're taking a medication in order to be able to assist that to occur. Well, there's also something where you can have pulsating pads that will pulse right through your arm and right through your leg and will drive the blood to the organ and back. So let's assume you had a diabetes problem and you're not getting enough blood supply to your leg usually. I'll demonstrate my hand because I don't think you want me to stick my leg up.
Stick with your arm. Stick with your arm.
We'll stick with it. So if, in fact, we were able to get the blood supply, which is the oxygenation of the areas, what keeps the limb alive, let's assume we have pulsating pads that brings that blood to the fingers and then back, or to the toes, because we usually lose lower limbs rather than upper limbs when we have severe diabetes, that in fact those limbs now work again. In fact, you've got now a method in order to be able to get somebody better. Let's assume that, for example, a person has a lack of oxygenation to the entire system. You might be able to go into a hyperbaric oxygen chamber and be able to help yourself. Hyperbaric oxygen chamber, the same way as you were doing a deep sea dive as you did in the Navy. Okay, so that's another way of doing it. Let's assume, for example, that the whole reason for your chronic problems, whatever they are, is that you're not getting enough nutrients in your food. That in fact, either you're not cooking your food correctly, or perhaps you need more concentration of a certain nutrient. You can do an IV drip and get those nutrients into your system, and as a result, the body can heal itself rather than being controlled by a drug. That's what occurs.
But you can do the same thing by proper eating.
No, you may not be able to.
You couldn't?
Yes, because number one, you and I have talked about this before. There's all sorts of definitions of proper eating.
Oh, I know that. Yeah,
and so we don't even know what proper eating is, particularly when the foods have been modified as much as they have, particularly here in the United States. So we might say we're doing proper eating, but you know that I went off wheat, and you know what happened as a result of my going off wheat. My bronchitis went away. So, all right, we're told on TV commercials we should be eating whole grains and all these types of things. And I go, as a result. So what am I going to do? Am I going to get off wheat, which is the cause of the problem? Or am I going to spray myself with the inhaler or take a steroid?
I get off the wheat.
Yeah. So that's why I'm saying look deeper into cause. So what happens when you go to a wellness clinic, you see a physician through nutritional therapy and a lot of other therapies that are considered alternative therapies, and I gave you a couple of examples of them. A prescription is given. Not a prescription to go to the pharmacy and pick up this drug, but a prescription is given to do those therapies that might help you with the symptoms that you have in order to get better naturally without taking the medication.
All this contributes to medication, but seniors are at a particular danger level, I think, Lee, because our body doesn't react the same at 70 and 80 as it did at 30 and 40.
Yeah, that's true.
So if we were taking certain medications and taking too much of it, or taking incorrect medications, over-medicating, it tends to have a more pronounced effect on our ability to perform.
Sure it does.
And that's a concern that I have. And how do seniors do a better job? How can we do a better job of not over-medicating?
Number one is to read. Is to have a full understanding of your own medical condition. Not just depend upon what the doctor tells you, because the doctor is looking at it from a particular viewpoint.
Right.
And frankly, there are other viewpoints to look at. And so be curious enough about your own body to look into that as much, or at least as much, as you would if you were buying a new car, if you were designing a new house. If you were paying me for dental work, you would find out everything about it because you're paying me.
If I'd have known what you were going to charge me, I probably wouldn't have gone into your office.
How do you like that?
Yeah, I know.
But you did anyway. So
I know, because I went to you because I trusted you to do a good job. And that's another basic thing of selecting a doctor. If you don't feel comfortable with your doctor, then I say get another doctor.
That's right.
Or
even if you're comfortable with your doctor, maybe you ask the doctor to make the diagnosis, but maybe you would go to a nutritionist to do your treatment and let the doctor follow up the results of the nutrition therapy before you go on the drug therapy. Let's assume you have a problem of high cholesterol.
Okay.
A lot of people do. And so they take cholesterol-lowering drugs, statin drugs. If you look into the research on statin drugs, you'd see that it's not the be-all and end-all in terms of helping you in your health long-term. It may be helpful for some people, but not nearly as many people as we think. It may not be as helpful for men as it is for women. It may not prevent first heart attacks. It may not do any of those things that we think it's going to do. But because it's artificially doing something, and it's making the numbers look good, so we're all happy with it. A better way of treating it. A better way. I'm not saying cholesterol-lowering drugs are absolutely bad. They're not. But if the cause of the problem is that you're eating the wrong things, and that in fact you work with a certified nutritionist who can tell you and guide you on eating the correct things and finding the correct sources for those things, and then you go back to your doctor for the 3-month check and do the blood draw again, and let's assume your cholesterol dropped down from 300 down to 200, would that be better than taking the cholesterol-lowering medication?
Certainly it would be better.
So all I'm saying is just don't stop at the drug. That in fact there are things that are causing that problem to occur to begin with. And I don't care whether we're talking about cholesterol, we're talking about any of the other things that we're chronically medicated for. We're medicated for cholesterol, we're medicated for behavior disorders, we're medicated for osteoporosis, we're medicated for hypertension. All of them may have a physical realm that can be looked at. And that, if we correct that area, then the patient can do better without taking medication.
It all boils down to one of the reasons why we're doing these shows under our new Focus on Seniors series.
Yeah.
We want people to realize that there are other things they need to think about as you develop your aging plan and your care plan. There's so many things that affect us. It's amazing to me how much we don't know. And I know that as putting all these shows together for the television shows and doing all the research and everything, I've helped educate myself. And some of these things I've discovered are frightening because like a disease called fibromyalgia.
Yeah.
It's sort of a catch-all name for a lot of things we don't know.
That's right.
And I can't find anything really not spelled out like diabetes, or it's not spelled out like if you have a wound care, if you have stenosis, you need to get your spine openings enlarged so your nerves are not pinched. Those things we can understand.
That's
Those
right.
things need to be done. We have a lot of treatments that lead up to these things, but
let me give you an example on fibromyalgia. There was a naturopathic physician in town for several years, and he happened to appear on my TV show, and as a result, we started working together. He was looking for somebody who would help his chronic pain patients, including fibromyalgia. He was looking for a dentist who knew how to make a certain dental appliance which would help to relax the jaw. At that point in my career, I said, no, I'm doing fine. I don't want to be bothered with that kind of stuff. He said, try a case with me. So I tried a case with him, and then I tried another case with him. And so I saw patients who had fibromyalgia, the worst of the worst types of patients, coming into my office. And through appliance therapy, meaning something we put in the mouth, and through natural hormone replacement and home physical therapy that he would teach the patient, I saw a remarkable number of people get better. They were diagnosed with this term called fibromyalgia. But in fact, they were deficient in something, and they weren't moving as well. We did a show on movement, which will be shown in this series. And they weren't getting the correct nutrition, and all of those things were treated, and the patient got better.
I know. I wear one of those things at night now because I'm starting to understand, and I frankly think since I've started wearing this mouthpiece that another show we're going to do on headaches, I think it has helped alleviate some of my headache problem.
Wow.
So, it's a little bit too early to tell, but we'll talk about it on the headache show. But
Okay.
on the subject of overmedication,
Yes.
I've been trying to glance at my outline here for the show today.
I haven't let you look at one question.
What else do you think that we might just quickly mention about the subject of overmedicating?
I think the only thing is one of responsibility. Particularly when we're in the senior group, we're kind of relying on the doctor for a lot of things. As we see the younger people, they do take a little bit more responsibility for their health, or some may.
Got about a minute.
But it is looking for yourself at what can be done, at what needs to be done, and taking the responsibility on your side, just the responsibility is being taken on the doctor's side, so that you're as knowledgeable about your situation as he or she is, and you'll be able to help yourself.
I agree with 100% with what you're saying, Dr. Sheldon. Subject of overmedicating is something it's intriguing, and it's something that we don't really talk about that much, but thank you for being on the show today.
My pleasure, Joe.
Okay, and thank you, viewer, for watching today's episode of Focus on Seniors. If you have questions or comments, please call radio station WMEL 1300 AM at 321-631-1300. For more information on senior care and resources, visit our website, helpingseniors.brevard.com. And I want to thank you for watching today's episode. And if you want, there are many other shows on different topics on our demand channel on the website I just mentioned. So watch our shows and tell other people. Thank you.